but they told me every which way to deny this. But there was one day that I was approved a certain amount of monies, and that amount of monies could cover one claim. A big one, yes, but it could cover one big claim.
Doesn't that sound a little fraudulent to you? She's describing a system where UnitedHealthcare approves a certain amount of money per day.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up.
Hey, it's Jordan with Status Coup. As the folk hero status of Luigi Mangione, the alleged shooter of UnitedHealthcare CEO Brian Thompson, continues to grow here in America, there is now another whistleblower that has come out, former UnitedHealthcare employee, blowing the whistle on what sure sounds to me like blatant criminal fraud perpetrated by UnitedHealthcare. Is anything going to be done about it? Doubt it. Let me show you this clip. This is from a former UnitedHealthcare employee who has gone public. I have reached out to her, by the way, for an interview. This is her on News Nation describing all the ways that the employees, were pressured to deny claims, including the company's supervisors hovering over them while they were on the phone denying claims. This is really, really evil stuff you're about to hear.
You were taught so many different ways to deny. Tell me more about that. What did you feel you were encouraged to do?
Every policy is completely different. So there was medical jargon in each policy that led us to have to follow these procedures. But more or less, we weren't given proper instruction to actually pay the claim, and there wasn't enough monies in certain files in certain companies to pay medical claims. So we would have to just get the client off the phone as fast as we could. And then if they weren't liking what we were saying from the script, then we would just call a supervisor and they would stand behind us. And while I was crying, they were laughing.
You would actually cry on the job sometimes?
Oh my gosh. It was so sad. It was so heartbreaking. I was the bad guy every single day. Does that not feel good to anyone? Like, that doesn't feel good to me.
While I was crying, they were laughing. I don't know if she means that literally, but I've worked in some offices before, not healthcare, with some pretty robotic, let's just say immoral supervisors. So it would not surprise me if you had these soulless bureaucrats laughing as they denied claims to those most in need. But there's something else that she said in there that I find interesting and maybe merits investigation. Not sure if you're going to get much investigation from the very politicians purchased by UnitedHealthcare and the rest of them. She said, and I quote, there was not enough money in certain files in certain companies to pay the claim. Why was there not enough money in the companies? Because UnitedHealthcare has several subsidiaries. Where is the money that people are paying for the plans, their deductibles, the copays, the co-insurance, all of that? Why was there not enough money in the companies to pay the claims? Where's the money going? Could it be going to the bonuses for CEOs? Could it be going towards stock buybacks, shareholder dividends? Where is the actual money we, the American people, have been hoodwinked and conned into providing to these unnecessary evil middlemen? I'd like to know more about why these companies don't have enough money in the coffers to pay out the claims, because to me, that begins going down the road of fraud. We know, Bernie Madoff, infamously, there wasn't actually money there that the investors were investing. It was just being kind of, I would invest in, not me, but, for example, I would invest in Bernie Madoff and he would take my money and instead of investing it, he would just pay it out to another investor. Ponzi scheme. So I find that very troubling. I want to also share, this is the viral clip from this woman that went viral on TikTok, where she described a really, really troubling instance where UnitedHealthcare was fighting tooth and nail to deny a widow the payout for her husband, a widow with, I think, 5 children, deny her claim for her husband who had just died of pancreatic cancer.
I worked in the medical claims department and went through training for about 2 to 3 months to get out on the claims rep floor, and was taught so many different ways to deny. Every policy is completely different, so there was thousands of policies that we had to kind of memorize, which was impossible, but they demanded it. They were so mean to us. But I'm here to talk about one specific claim. It was a widowed woman calling me at least 2-3 times a day, asking if I knew anything, because they were taking her to court for this. Her husband had just passed from pancreatic cancer, and this was a hospice claim. They were already garnishing her wages, and this was less than 60 days after he died. By the way, she was left with 5 boys by herself. She was a stay-at-home mom her whole life. She was just trying to figure out life. There was absolutely no reason why we couldn't just submit this claim and be done. But they told me every which way to deny this, to get her off of our phone line. It was absolutely despicable. But there was one day that I was approved a certain amount of monies. And that amount of monies could cover one claim. A big one, yes, but it could cover one big claim. Big meaning, I'm pretty sure it was like 400,000, 500,000, a lot of freaking money. But they were expecting this single mom to pay it. Oh, and by the way, they took all of her insurance from her. So she didn't work. She had no health insurance. Her boys didn't have health insurance. It's a clusterfuck. Needless to say, I went in, paid it, went on timeout thing, went and told my supervisor that I quit, and I walked out of there.
Wow. So first, obviously that's disgusting. They're taking a widowed mother to court with 5 children because they won't pay the hospice claim for her dying husband or dead husband's hospice. I mean, that's just vile. That's why there is the hatred that is behind Brian Thompson, UnitedHealthcare, and frankly, the support for Luigi Mangione. And let me know what you think in the comments. But again, doesn't that sound a little fraudulent to you? She's describing a system where UnitedHealthcare approves a certain amount of money per day, not evaluating each claim on the merits, whether it should be covered. But hey, here's a pot of money. This is all the money you're allotted to approve claims. So it doesn't matter whether a claim is valid or not, should be approved or not. Here's all the money you have. So you could only approve certain amount of claims. That is not what these companies are selling to the public. That's not how they're advertising to the public. I don't even think that follows American law. You can't just say, hey, here's, $500,000 for the day. You could approve X amount of claims. That's not care. That's fraud. That's not health care. That's health rationing, frankly. It's just absolutely disgusting. And it kind of jives, frankly, with the whistleblower we spoke to, I believe a few weeks ago. Remember, I spoke with a former UnitedHealthcare worker by the name of Jenny. She was with them 10 years ago, but what she described, not her direct experience, but what she was hearing from coworkers, very much connects with exactly what you heard from Natalie. Let me replay that clip for those of you that didn't see it. This was a former UnitedHealthcare worker, Jenny, who described her experience working at UnitedHealthcare.
On break time or whatever, when we would all kind of come together in this kitchen clutch and people would be talking about what they were told to do their job. It wasn't my job, so I can't say 100%. Yes, we have to deny so many claims per month to meet our shareholders' expectations, but I do know that people were complaining because, they had to meet a certain amount of claim denials.
So people were telling you that there was a quota for how many denials?
Yep.
Which is kind of like less deadly, but cops towards the end of the month, you have a quota how many tickets you have to give out.
Right.
So that was over 10 years ago. This woman I first showed you, more recent, supervisors hovering over you when you're on the phone with patients to deny claims. you know, here's your allotment of money for the day. You cannot approve any money past that. There was companies or subsidiaries within UnitedHealthcare that didn't have enough money in the coffers to approve claims. Where's the Department of Justice investigation? Huh? We're going to get one? Yeah, probably right behind the bankers that were not jailed for tanking the global economy and defrauding you, the American people, and many of you kicking you out of your houses. That's probably where that is. I want to show you another clip. This is from a local Tampa Bay station where an 81-year-old man with debilitating back pain, doctors say he needs surgery to fix this debilitating back pain, and the health insurance company won't approve it. Thus, all he's left with is basically opioids and being hooked on opioids, which obviously is a massive problem in this country. Here's him describing his ordeal with the healthcare companies, and frankly, him feeling that Luigi Mangione is, in a way, a modern-day Robin Hood.
The pain brings tears to my eyes.
The former bodybuilder and powerlifter,
I've never drank or smoked in my lifetime.
is battling a debilitating back injury.
I've got 2 files right here that I work on every day. Cleveland Clinic.
Taylor says his Medicare Advantage insurance company refuses to pay for the surgery his doctor says is needed.
And they deny it. Keep on denying it.
That denial of coverage struck an emotional nerve after the shooting death of UnitedHealthcare CEO Brian Thompson.
Sorry. It's time to stand up.
While Taylor says he feels badly for Thompson and his family,
Number one, of course, it's wrong.
he views suspect Luigi Mangione as a folk hero who targeted the wealthy and powerful.
It kind of resembles like a modern-day Robin Hood. Now that they've got number one is gone, over the hundreds of thousands of lives that have already been lost because of neglect. These are the opiates. This is the oxycodone that I take.
Without surgery, Taylor says he's become addicted to prescription opiates.
Here I take up to 4 a day, and it all can be corrected and fixed. They won't let me get off of these drugs.
Taylor says it's cheaper for his insurance company to keep him addicted to opiates than paying for surgery.
Any of you seen the awful documentaries or scripted series on the opioid epidemic and the Sackler family in particular? All of them should be in prison for killing hundreds of thousands of Americans from these opioids. Well, the for-profit healthcare CEO should probably be sharing a cell. They could just give this poor elderly man surgery. They won't. They're denying it, even though the doctor said he needs it. Thus, he has no choice but to take opioids, which make the insurance companies more money. It's just absolutely vile. And all of this kind of explains and makes it a lot more sensible why the majority, it seems, the overwhelming majority of Americans are blaming insurance profits and denials alongside Luigi Mangione, the alleged shooter. This is a new poll. Most Americans blame insurance profits and denials alongside the killer in UnitedHealthcare CEO's death. Most Americans believe health insurance profits and coverage denials share responsibility for the killing of UnitedHealthcare CEO, although not as much as the person who pulled the trigger. In the survey from NORC at the University of Chicago, about 8 in 10 U.S. adults said the person who committed the killing has a great deal or a moderate amount of responsibility. Despite that, some have cast Luigi Mangione, the 26-year-old suspect, as a heroic figure in the aftermath of the arrest. About 7 in 10 adults say the denials for healthcare coverage by insurance companies or the profits made by the health insurance companies also bear at least a moderate amount of responsibility for Thompson's death. Younger Americans are particularly likely to see the murder as a result of a confluence of forces rather than just one person's actions. So the polls show, yeah, obviously the majority don't condone murder. They say Mangione, the alleged shooter, bears the majority of the responsibility, but not far behind that is the victim, Brian Thompson. So clearly, this Robin Hood element is major, and that's why I believe in this case, particularly them charging him as a terrorist. I think they're going to have a very hard time finding 12 jurors all to find him guilty, particularly after more information comes out in this trial. Because I don't think the defense, they're not going to simply leave it as Luigi Mangione is on trial. I believe that health insurance industry is going to be put on trial, which then brings in jury nullification, which is essentially a jury can believe that the person committed the crime, but essentially make an exception and find him not guilty if they feel the crime, was justified. And that is legal. That is a legal way for a jury to act. And I've already over the weeks shown you reporting of signs going up across the nation. Street signs in Seattle in particular were hacked, free Luigi. Now in New York City, the mansion of disgraced pedophile Jeffrey Epstein was graffitied and defaced by supporters of Luigi Mangione. Let me read you this. Pro Luigi Mangione vandals, this is the New York Post, defaced the exterior of pedophile Jeffrey Epstein's former Upper East Side mansion this week with the 3 words the accused UnitedHealthcare CEO murder scratched onto the bullets he used to kill his target. Deny, defend, depose. Red spray paint was used to deface the East 71st Street home's gilded facade with the phrases "Free Luigi" and "They fear the people." Across the front door, the goons scribbled the 3 words now synonymous with Mangione's names: deny, defend, depose. Obviously, this is not Epstein's mansion. After he, quote unquote, killed himself in prison, this is now, it was purchased by former Goldman Sachs executive Michael Daffy for the cool price of $51 million a couple years ago. But this continues. You are seeing signs, "Free Luigi." You are seeing street signs. You are seeing wanted signs for healthcare CEOs popping up on subways, which then are pulled down by police. Now you're seeing mansions graffitied supporting Mangione. And, to me, you could have 2 thoughts at once. No, I don't support, vigilante justice. I understand the feeling behind wanting to harm or kill CEOs, but again, murder is murder. It's wrong, and it could boomerang back on us, and it will boomerang back on us tenfold if Americans start shooting down CEOs and the capitalist corporate criminals. Trust me, it will come back on us much, much worse. And civil liberties, forget it. They will be. You think COVID had a lockdown? You will have a lockdown in America, and your civil liberties will be taken, and the police will be brutal in the protection of the CEOs and the corporations and the politicians, by the way. But at the end of the day, this is not just about the health insurance industry. This is not just about Luigi Mangione. This is not just about Brian Thompson. This is about capitalism. This is about late stage empire. This is about the 40-year neoliberal bubble popping. The people are fed up. The people are angry and fed up. And I believe this new whistleblower who went on News Nation, I believe she kind of said it best. She was asked, what is your message? What are you trying to get out of this for coming public? Let's take a listen to what she wants people to take away.
We, the people, are sick and tired. We're fighting so tooth and nail every single day. My neighbors around me, hearing about their premiums coming out of their paychecks from the RIP, is just so incredibly sad. What this family could do with this money would be so amazing to relieve our people of this. But there's a better way. Do I know what that is? I have no idea. But what we have in the systems that we have right now, it's just not fair, and it should be done and over with.
We, the people, are sick and tired. Couldn't have said it better. Continue supporting Status Coup. You can become a member for as low as $5 a month. we are going to stay on this story as the corporate media obviously wants to move off of it and already has. Support us, statuscoup.com/join for as low as $5 a month.